So, Megan, Linda, you've all been involved in the health sector and in engagement for a while. So thanks for making the time. And I guess there are three main questions I had, and happy to go other places as well. But engagement is picking up as an area of interest. You see lots of parts of the health sector talk about consumer engagement, but also clinician and other forms of engagement. So my cheeky question is it genuine, or is it a means of achieving an accreditation standard? Like, what's your kind of experience of engagement and what you're seeing?
I think when Standard 2 first came out, the health consumer movement got very excited because it put us on the agenda and we had to be there, which is great. But I think over time, you sort of see it can be a bit of a double-edged sword if you're part of an accreditation process. And so you're on the agenda, but you might only be on the agenda once every 3 years in a really, not necessarily genuine sense, but in an urgent sense. And I guess the thing that I keep saying over and over again is that when it becomes the way you do things, then you don't have to have a mad scrabble every 3 years. It just becomes core business. But I would say conversely that Standard 2, I think, has forced people to engage who may not feel comfortable engaging, and many people then come to see the value of it.
Yes, I think you're right. A lot of people will start because they have to, and then they will continue because they want to. And I think that's the difference. And realising that the reasons for people starting, on their community engagement or consumer engagement process may be quite different. But I think as long as we can facilitate and encourage and continue to help people to make the best efforts they can within their own circumstances, that it will be more than just lip service.
I think more and more it's genuine. I think even when it's imposed, there is still a genuineness about it. I think it may not have always been perceived that way, possibly because people didn't have the skills or the resources, they didn't quite know how to, and so what they attempted to do seemed tokenistic. The person engaging may not have come at it from a disingenuous position, but as it's become more commonly done, people are building a lot more skills and capabilities to engage in many different ways and finding a much greater richness in it. So although it's still a must-do in a number of places, the benefits I think are outweighing, or people are starting to see that the benefits are much greater than just having to do it. They're doing it because it's really making sense and it's really enriching an outcome that they have, and it's enriching the quality of their work. It's much more enjoyable to have a conversation with consumers and engage them and understand their perspectives before a change is made or imposed, rather than trying to have this crisis management and reacting to outcry after a change is imposed. That takes a lot more energy, and it's harder for the health services to address that, rather than putting all that energy in beforehand to understand and help people share their perspective, so that the health system's better informed, and then can help explain why a change might be being made, or can use the consumer's input to make it the best outcome.
I think that's
for both parties.
Yeah, I think that's a really key point, because if you're trying to design a system or a service and you're not actually asking the people who are receiving the service, you're not going to end up with as good a result as you will otherwise. I so often have that experience where people will go,
wow, the consumers had
Actually,
awesome
yes,
stuff to
I know.
say.
And it will really perhaps shift or tweak
Yeah.
what's been planned.
Yeah.
And that's the great benefit of it. But I think you made a really important point too, is that around, it is a skill, and it's a very different skill from being a good clinician, and it's yet another thing that busy clinicians have to then try and tackle. And I guess for me, that's the thing I'm really passionate about, is how can we support each other on this learning journey of engaging better.
Yes, yeah, and I think that's important to realise that it doesn't have to be someone else's job.
Yeah.
You know, it can be something that you can do as part of your daily clinical work, or,
Yes.
you know, if you do happen to be working in more of a community-facing job, then that's great. But I think it's that authenticity that you bring to it, so that you are genuinely interested in what the person has to say, and that you're clear with them when you first start about what they can expect. You know, so you don't go out and ask people to be intimately involved in designing, you know, the little widgets if you don't want them to tell you what colour those widgets should be. You know, so you're very, very clear about, this is the opportunity, this is how we want to engage with you, this is what you can expect, and this is what we'll do with the information that you give us. And I think if you have those sorts of things as your foundations, people will realise that, you know, it's not a scary thing to do.
One of the things I guess I just wanted to chime in is, because you're kind of talking about the supporting clinicians and the change in mindset, because the medical model is one where you absolutely need and want clinicians to have answers and to come with answers and to be proficient with those answers. And you actually see it in fire emergency sector as well, where they're used to the command and control, and so engagement becomes difficult.
Yes.
So what are the things that support the clinicians to change that mindset? Because one is to go in with answers, the other is to go in and maybe not know the answers.
With questions.
Yeah, so
And I think
how do you support that?
idea of sharing the problem as early as you can,
Yes.
rather than
Yeah.
finding the problem, working out the solutions, and
And
taking
then
the
going,
solutions
"You
and
are."
engaging. You know, and that's just human nature. We all do that. That's not a clinician specific thing.
No.
But you know, that's learning that skill of of sharing the problem as early as possible. But I guess for me too, I sometimes wonder just how clinicians manage the crushing load of mandatory training they have to do every
Yes.
year, and policies. There's a constant churn of policies being reviewed. How could they possibly be across every last thing? And I guess I'm a believer in having not just a workshop, but having a space where you can continue to apply your learnings. And I guess that's really, this whole conversations we've been having about the community practice in the first place is about how do you create that learning environment that's not just a one bite of the cherry, 4 hours, this is how you engage.
That's right, yes. And the people can continue to build their practice.
Yes.
And recognise that good relationships, can support good engagement, and that it is something that you need to work on.
Yeah, and I think the point you made, that really important point of setting the boundaries of what you can and can't engage on, because the trust is the key thing in the engagement. People feel it's tokenistic if you end up providing feedback on the colour of the widgets, but that was never on the table.
That's
So
right.
it's really about trying to be really clear about what is and is not on the table. And there's nothing wrong with being really clear, like, this is the budget,
Yes.
this is the room, this is all we've got, what can we do within this space? So you try and share the problem, but really clearly which part of the problem.
So are there areas where you're seeing that happen really well? Like, are there kind of examples you can provide where you go, actually, you can see, they've really kind of got not just the need to do it, but the want to do it, and have learnt the skills?
I guess for me, yes, learning the skills is important too, but also what about partnering? I think we all go so much further. I mean, in health networks, you partner all the time with people to support them in engagement. Health Consumers Council is the same. I was just thinking about, I'd say, the Fiona Stanley Hospital, the work they're doing around the Family Birth Centre.
Yes.
So it's about working with, like the Health Consumers Council can do stuff on Facebook, that can build a bit of a community dialogue. But
Not
it's
just leaving it to
No.
one group to
I
have to
think
do all the
it's
engagement.
partnership. Yeah.
nice.
Yeah.
And I think, you'll build a partnership with someone that might have some subject matter expertise and
That's
somebody else who knows that local community. And together you can actually get, you know, a beautiful outcome, if you like, because, you know, no one thing is more important than the other. You're both bringing your area of expertise to the table, so to speak, and learning from one another.
That's an approach that we at the Health Networks undertook recently with development of the youth health policy.
Yes.
That a really underlying principle of that was to engage with youth, to contribute to the policy. Even though the policy was for health service providers, it was important to have the youth voice there so that there was a real understanding of what was important to them for their health and their health care and how it was delivered. So partnering with a number of organisations that already have some really great relationships and networks with young people was critical to drawing on those voices rather than having to start from the beginning ourselves with building that that base of young people to reach out to. It was partnering with organisations that could very quickly interact with them because they had all the mechanisms set up, and working in partnership with them as to what we need from what we wanted from the youth to help with the policy, and for them to go out and interact with the youth that they already had the relationship with. So you know, that's been a fantastic example of I think of consumer or the youth engagement, and that's just led on to now such an incredible uptake of the policy and readiness to implement it in different creative ways.
And I guess leading on from that, the young people and the youth experience, I think the development of the headspace in the Pilbara region would have been another one of those examples where Amplacare, as the lead agency, used their human-centred design process and engaged incredibly well with young people, with service providers, with, you know, anybody who was really interested in being a part of the development of this new service in the Pilbara. And it was really important because the Headspace Pilbara was not going to be a traditional Headspace centre. You know, there was talk about, you know, turning the Headspace inside out and, you know, having it delivered the services that you would get with a traditional Headspace centre being delivered from a range of different community-based buildings and, you know, from schools and from lots of other places. So it was really important to engage those local people to find out what was possible and what wasn't. And surprisingly, you know, the timelines, which were of course very tight, were met, and they have a functional, you know, headspace in the Pilbara now, which is operating from Headland, Newman and Karratha with some other, you know, sorts of outreach. So it's a matter of talking to people, finding out, you know, what they want and what they think is possible. You know, bearing in mind all of the other constraints that there might be in these remote locations particularly.
I think there's a couple of really key things there. One of them for me is time. I think it can take a little bit more time than we realise, and that can be difficult. But again, I think you can short circuit some of the time things when the relationships are already there.
Yeah, but it is worth taking the time initially, isn't it? Because otherwise, if it goes wrong, it's going to take you a lot more time in the long term.
And you know what's interesting is more often than not, the time limit is self-imposed. So we actually create a project timeline and they want to engage within it, and then we go,
it's not realistic.
It's not realistic, and so actually we're going to have engaged well. This is build that into the project.
I know the other thing I was going to say was just the importance of, you know, the place-based approach, and that, you know, everything does need to be adapted to where it is. And
context is everything.
Context is everything.
I've been hearing a lot about the Coburn Clinic, and particularly an obesity program down in Coburn, but I don't know the details of it. But the South Metro looked at taking some clinical appointments out of the hospital and actually putting it into the Coburn community, and the community sort of have come together and looked at what will best suit their needs and putting that into place quite effectively.
Yes, and we've actually been working with the Coburn group as well, which includes their local council, and have given them a little bit of seed funding just to really get to the stage where they can fully document their model so that they can be able to demonstrate what's happening already, but also use it as a way of engaging others into it, because it's much easier to engage people into something if you can really tell them exactly what it is that you're doing and what they can add to this. So there's a group of very committed people there already, and so just being able to demonstrate exactly how somebody else might fit into that space, I think, is going to be really important.
So then, it's interesting because as you're talking, so we started off looking at yes, there's an accreditation, and that might be a driver, but actually that can be for a good end because people kind of get the flavour for it and see how it might work. What are the things that you see, what are the systemic or cultural changes that you see parts of the health system undertaking in order to have engagement, not just be a once in a 3 year kind of thing? Like, what are the changes that you see in organisations or parts of the service needing to do so that it becomes more a way of working?
I guess for me, I think that culture change is always the work. I think that a lot of time and energy goes into creating documents. The documents are just the beginning, and the actual implementation, I think, often staff aren't well supported to implement. And just one of those mechanisms around culture change that the Health Consumers Council sees as quite beneficial is transparency. So that is why we've been so supportive of the patient opinion platform, because that offers the opportunity for a safety and quality conversation between services and the public. And what facilitates that is the fact that it's an open but moderated platform. So whilst it's open, it still has some protections in place for both parties. So for me, culture change needs some drivers, and I think that transparency is one. I think another one, and I've already alluded to it, is to have a safe space to actually learn to put a lot more time into the implementation, a lot less time into creating the policy, a lot more time into the implementation. Because often you'll get a policy and it'll be lucky if it has one page of implementation and there's no easy way to track how that implementation is occurring. So that transparency around how things are implemented too, I see as real potential way forward.
I was going to say partnerships really impact the culture and systemically, and so for the Department of Health, having partnerships with Carers WA, with WAFA, with Health Consumers Council, to be supporting that culture change and to be bringing your voice in the importance of consumer engagement and how can we do that better. And I think you're starting to see that culture change where the Sustainable Health Review is happening. There is now a consumer reference group. So it's really recognising the value that consumers and carers can bring to something as far-reaching as a Sustainable Health Review. I think there's culture change on both sides, though. I think there's definitely the culture change within the health system, and that engagement can happen on a very large scale or a very small scale within just a clinician's work. I think there's system cultural change with the consumers and carers as well, for them to be feeling more comfortable in bringing their voice forward, in them having the skills as well in how to bring that voice forward effectively, and where are avenues and platforms for them to do that. So it is a two-part culture change, I think.
I see what you're saying. The thing, it is different. I mean, one is a bit more about skills and an understanding that you have got a role, because a lot of people don't realise it. A lot of people don't even realise they have basic rights, like the right to say no to treatment. People are not even aware of that. People don't necessarily step right up and own their health, and really it's such an important thing to really to treasure and look after. But I think there's something else around that. I think I can see such a great future for engagement that's much broader and much more representative. And I think, that again, there's some great things that the system can do to support that. And I just would reflect, I've done some work in the health sector, but I've also done work in the victim services sector, and the health sector is way ahead of the victim services sector in really involving consumers. So
Good to know.
I think it's important to sort of acknowledge that, and that the structural things that have been put in place by health they sometimes, for example, you know, the community advisory councils and the district health advisory councils, they've got some really good things about them, and they could potentially have other ways to ensure, you know, that, you know, a more diversity potentially, or that other mechanisms are utilised in partnership to create that diverse input, that there's more, you know, perhaps flow through of people, you know, just trying to get that balance right. You know, so I guess I just would reflect there are some great structures already in place, but, you know, there can be really good cultural shifts amongst those.
And I think, just picking up on your point about diversity, I think one of the things that we as professionals probably need to think about is engagement isn't just engaging with people like me.
That's exactly right.
You know, it's
So
engaging with anybody who is within a community or who is likely to be a user of that particular service, because they are the people that know what works for them. You know, and I think we do tend to underestimate the experience of consumers and people in communities, when really they are the experts on what works for them.
On their experience.
Yeah.
And sorry, I was just going to say too, with the sort of with the community advisory councils, for example, and just going back to the Fiona Stanley example, I encouraged them to connect in with the community advisory council because they hadn't. And that's when that was another really fantastic partnership that put it forward another whole step. And I guess I see, I mean, I think that hospital boards are just full of your next consumer rep superstars that you just don't really know about. And I think that's the opportunity again to work with CAC members to actually go out and speak to people, and so that people sort of understand, oh, okay, there's somebody doing that sort of work. For some of us, I mean, for myself, I mean, I've been in this business 19 years. My daughter's now 19, but I got into it because I was really passionate about maternity issues, and it really, you know, it really is, for some of us, it's just what we really get a passion for it, and the passion never goes, and it's a fantastic resource, I think, for the health system, but it's about harnessing that and about making sure it's being used in a useful way. You don't want to be, and just make it, you know, don't waste time engaging on stuff that you can't engage on. That stuff is just, you know, fixed. Let's work on the bits where we can influence.
Very cool. Any final words?
Oh gosh. I mean, it's pretty hard when you ask an old community development girl, you know, the value of community engagement, because it's just what you do. And you sort of forget that people don't necessarily have that experience. And I think for me, seeing now that that a system such as, you know, the health system does genuinely value the skills that, you know, are sort of innate in those that you know, have worked in this area for a long time, is just fabulous. And I think people shouldn't underestimate their ability to engage in, you know, a respectful relationship with others. You know, you do it with your friends, you do it, well, hopefully you do it with your friends and your family and those sorts of things. So it's taking it that next step to just be genuinely interested in what somebody is telling you. I think that's important.
I guess I would say that engagement is complex, and I think it's really important for us all to have a bit of humility around it, and nobody's really got the corner marketed on doing it perfectly. It's a very iterative, generative process. And I guess, you know, and again, I would just get back to that sort of concept of having a supportive space, like community practice helps those skills to develop.
I think some things that people get concerned about when they go into engagement is being seen as they'll just be called tokenistic, or but then they hear, on the flip side of it, they hear, oh, there's engagement happening with everything, and people have engagement fatigue. I guess what I encourage my team to consider is people get engagement fatigue when the consumers feel that they've put a lot of emotion and energy into informing and answering questions, but they can't see the result of where that has come out. And I think it's that transparency to say, this is what we heard you say, this is how we've used it, this is how we probably couldn't use it and why, so that people feel it has been genuine, and they won't feel that engagement fatigue. You get fatigue because well, I keep putting my voice forward, but you're just not taking it on board, and you're not hearing it, it's not making any difference, so why do you keep coming and asking me?
What's the point?
Yeah.
What's the point? So it is really about taking that time, being humble and having humility about, well, this person might have something really valuable to tell me, but how can I then honour that and take on board what I can to help influence and shape what I'm producing or what I'm going to deliver or what we're going to be creating in the health service. So I think that's probably a final point from me, and very important to keep shifting that cultural change for both sides.
Awesome. Well,
Thank you, John.
thank you very much for your time.
Thank you.
Really
Thanks,
appreciate it.
Jim. Thanks.